Okay, so Jim, hi, how are you?
Hi, fine. Fine. How are you? It's
I'm
after
fine
long,
too.
I think, almost 2 years now. I think we are in touch with.
Yeah, 2 years. Soon after you moved away from Goa, I think we stopped being in touch.
Yes, yes, yes.
Yeah, how is it in Kerala right now? How are you doing?
I am working as a clinical psychologist and principal in an autism center. It's an autism
Okay,
center, basically. Apart from that, we have children with developmental delays, autism, and maybe children from very early age, maybe
mm,
6 month old, 1 year old. So children will be there, and we have adult cases also. We have all the department like occupational therapy and special education. So we are utilizing all the department to train the children.
okay, all right. And you're enjoying your
Yeah,
job,
for
I
the
suppose.
yeah yeah okay now enjoying. This is a new area, no, because I was not exposed much to this. Now I enjoy that.
Okay, so now let's take a pause here. I want to start right at the beginning. So
Yeah,
tell us about your graduation, your master's, your MPhil, where you did it, how was it for you?
yeah, sure. I actually did my degree, B.Sc. Prajyoti Niketan College. That was in Kerala. Psychology was not that, the courses were not what we call not that regular. You will
Mm,
find very few centers where psychology courses were running. So I was lucky to have a course in Prajyoti Niketan College. They what we call visionary in that sense, we can say, because had a good what we call vision about psychology, holistic psychology he was speaking about. So I
mm,
had a chance to enroll there for B.Sc degree course,
mm,
3 years B.Sc course, where intensive training we got on physiology, statistics, and that was a college where we have a very good professors working in that
mm.
college, so that was very good exposure. After that, what I did was I did my PG in psychology from SDM College. I don't know whether you know about it. Many students from Goa also study there now. SDM
Okay,
College.
okay.
That was also clinical and counseling psychology. After that, I did my MPhil in clinical psychology from Kasturba Med. So that was studies as such.
So I will anyways now what's happening because of network correction, there's a lot of breaks in the middle. So I will of
Oh,
course take all the names of the colleges from you in detail and I will put it
okay,
in the
okay,
bio so that the students can get the exact name of the college later. So I'll ask that in detail from you later. But
okay, okay.
have you always been interested in psychology right from the beginning, or was it something that you learned to appreciate and gained an interest in along the way? How did it happen?
Yeah, actually, I was interested in psychology because I learned there was a magazine. It's called Psycho magazine. Was there in Kerala? I was reading it
Mm.
before 10th standard. Also, my brother used to read psychology magazines. So
Okay.
psychology, that term psychology is something different from the normal reading and things like that. So the basic understanding was that we can know the minds of people. So I was
Mm.
also interested in many of the terms, many of the concepts at that time people were discussing about. So I started,
Mm.
I can study psychology so that I can know the minds of people. That was my
Yeah.
initial. So I started studying. So it was my genuine interest to pursue my studies in psychology degree.
Okay. Okay. And then, so after you finished your MPhil, what was it professionally? I mean, did you change a lot of jobs? I know you worked in Goa for a while, but were you working somewhere else as well before that?
Yeah. Immediately after completing my MPhil, I started working as lecturer, assistant professor in one of the college. And during
Mm.
that time, I was working as a clinical psychologist also in an center called MHAT. That is a
Mm.
community psychological intervention center where we
Mm.
used to give intervention in the psychological setup, community
Mm.
setup, where day we used to go to the different community where this mental clinical setup was there. So we used to go there, and there were a lot psychiatrists were there, and along with that we were giving a psychological intervention also to the need.
Hmm. Hmm. And after that, after that, where were you later?
Yeah. So that after that I was in one of the private hospital,
Huh.
whereas I was working consultant clinical psychologist, where I directly started seeing case. So consultant means we can independently work on that, no?
Hmm.
So I was a consultant clinical psychologist, and of course I was getting a lot of references from psychiatrist over there, then
Hmm.
general medicine, pediatrician, and from even what we call dermatologist. All the different cases were also being referred to me that time. So after that only I came.
Okay. After that, you came to Goa. Okay.
Yes, yes,
So it's a pretty different journey you had, no? From community medicine to private hospitals to then a psychiatric and IPHB, Institute of Psychiatry and Human Behavior in Goa, and now you are
yes, yes.
specializing in autism. So how has it been seeing all these different facets of psychology for you?
Yeah. Well, in psychiatry hospital in Goa, I can surely tell that it was a hectic time for me.
Mm,
Lot of assessment was there, intervention was there, lot of adult cases, child cases. Mainly, we were into assessment. No, that was the main thing. Intervention was very less.
mm,
So afternoon and sometimes only full of the time I was doing involved in assessment, learning disability, ADHD, then
mm,
autism, then other multiple disabilities, things like that. So it was for certification. People used to come. So assessment, and apart from that, for the medico legal cases were there. Many cases from the legal cases were brought to us from the jail and
mm,
things.
mm.
So it was that I perfected, I can say, my assessment skills.
Uh-huh.
Doing lot of assessment. It was a very good time, and that was also a time where I could interact with the psychiatrist over. Many of the psychiatrists.
Okay, so when you say medical legal cases, you mean these are cases which are pending in the court right now. They are in the judicial process, and they have asked you for your opinion on whether the person, for example, is competent to stand trial or to do an assessment of the person, something like this.
In Goa, what I found is that all the cases, especially suspected cases, they are brought to the psychiatry department, and that includes even foreigners or the locals, many criminals, or those who committed POXO, is related case. So many of
Yeah.
the cases were brought to rule out whether they have any psychological issues.
Okay.
So many cases were brought. Yeah. Even suicidal attempt case also were brought to us.
So,
Legal cases were regular.
okay. So then, what was a typical day like for you after you joined, after your MPhil? So, because a lot of my students are interested in choosing or rather pursuing MPhil as a career option after their masters, but they're not sure of how a typical day would be or
Okay.
what they would have to do throughout the day. So, should they expect after MPhil?
My personal experience is that after PG, I thought I have learned something on
Mm,
psychology. I have learned much theoretical and practical exposure I had. That was my initial understanding. But after starting MPhil courses, where we really interact with the patients, we interact with visit to the various department of medical college.
mm,
So the real learning started there only, MPhil, during the MPhil time.
okay.
And during the PG level also, practical exposure we don't have. So during MPhil time, you will have a lot of practical exposure. Of course, in the medical college, you will get exposure to various departments. That is very good exposure you will have. So after the MPhil, you are alone there, and you may not see the cases that you have seen previously. So you will, sometimes you may be stuck. What I have to do with this? No, I have a little bit knowledge about it. So, but I don't know how to deal with that. So every day we have to do a lot of reading related to that. Maybe case history or case management, the case studies. So we have to read a lot. One case maybe we will get a diagnosis definitely, but each individual may be presenting the cases, presenting the problems differently. There are a lot of complications. So to manage that, we will have to read a lot. So I was doing a lot of personal reading related to psychological intervention, psychological therapy, and we may have learned typical therapy like CBT or
Mm.
rational motive therapy, things like that. But specific to that, this individual, what therapy can be done? So there is nothing. We will not get anything specific to this individual. So from our learning, from our theoretical knowledge, we formulate as what we call as psychotherapy formulation. We may have to make on each
Mm.
individual and work on it. So that's what. So the learning did not stop after completing MPhil also, after completing
Mm.
PG also. It continued. So that I think
Yeah. Yeah, the learning never stops. You have to keep yourself updated with whatever is happening and whatever new comes up. You cannot stop and assume that you know everything. No, you just have to
yeah.
keep learning throughout. Okay. Uh, how was the caseload like for you at IPHB after your MPhil? How many cases did you see per day? How many hours did you spend doing assessments? And then you had to interpret and write up the reports. What was that like?
Yeah, yeah. Yes, yes. It was very difficult in the beginning, especially. In beginning, it was okay because we were four clinical psychologists were there. But
Mm.
after some, I think some 6 to 8 months, two of the clinical psychologists, one was continuing on after
Mm.
retirement.
Mm.
Both of them, one of them, I think, got job in another place. So we were
Okay.
only two clinical psychologists handling all, including children. And so almost, I think, maybe more than 15 cases we were seeing. And there were some emergency cases, like I said, they need urgently. Tomorrow court has to ask. So we have to produce a report by tomorrow. So such a lot of cases were there. So children's case, they have to write exam. In order to get exemption, they need a certificate. So almost 15 cases per day I was seeing. So especially learning related problem or IQ, we can give issue certificate at the earliest. There is no issue. But for psychodiagnostics, that requires a lot of effort. If I do Rorschach, it has to be
Mm.
ordered, it has to be interpreted, the report has to be written. So it's a very big work, we can say. It's not that simple. So what
Mm.
I did was that I took all the protocols, started working on it. Maybe 3 4 hours I was sitting in my room and writing the report. The morning I will attach the report. So that much work I was doing during that time because it was hectic, and very few clinical psychologists were there. So that is, we can say that work related thing is more in government hospitals because there will be a lot of patients, or the cases will be coming to the department.
Yeah, the volume is going to be more, no? Because as it is, the ratio of mental health professionals to those who need the help is so small that you're going to be
Yeah.
overburdened with cases from day one. And you
Yes,
cannot even
yes.
choose your cases, like you mentioned. You won't choose, you can't choose what you want to see or what kind of
Yeah,
cases
yeah,
you want to work on. No, it's just whatever comes your way, you have to take
yeah.
that. Yeah. Okay. So now,
Yeah.
yeah, go on, go on.
Yeah. One more thing, because we give appointment every day morning till evening we have appointments. So 3 4 months appointment was already given. So they usually come every day. 3 4 months in advance we give appointment. So
Oh,
apart from, we have to see some other cases, adult emergency cases, MC cases. So unscheduled, not appointed cases also we have to include in that. So that was another hectic work that we
Yeah.
were doing. But I was happy with that. Even if we don't know how time goes. So morning I come to the department. No, when I look, time is over now. There is no time to be idle. That's all.
Okay. Okay.
Yeah,
So that was your experience in the public health sector when it came to IPHB. How was
yeah,
it
yeah.
previously then? Community medicine and then in the private hospital, how was it different from those two experiences?
Yeah, community medicine or community mental health program was very new to me that time. I, I was not knowing much about it because we have thought about the clinical setup where we go and patients come. That's all. So here, what is that we will be seeing very poor people, very marginalized people, because those who are not able to afford
Hmm.
government medical or the medical setup. No, so we go to a particular center called maybe. I think you might have heard about the palliative care centers. So every
Yes.
community, especially in Kerala, we have a palliative care centers. In every village there will be. So those villages we will be going, and patients will be brought to that clinic. So the psychiatrists, along with social workers and clinical psychologists, these are the team who will be there, and we will be taking the cases. The cases will be discussed with the psychiatrist, and psychiatrist will provide, the clinical psychologist will be taking it. And some other home related thing, some other things has to be normalized as psychiatric social workers also will be involved. So there was a distance was an issue. From morning maybe 5 o'clock we have to start from, and or even more than that. So that much distance was the institution where we are working. So they will be taking us to the respective centers. So each day we will be going to different centers. And Monday, for example, I'm in one center. The next day I will be in another center. So it will be automatically scheduled.
Okay. And how was it in the private hospital?
Yeah, private hospital, it was job was much relaxed because we did not have much cases. Only cases referred by the psychiatrist and other department. It was okay. It was just like a normal with the patients. We will get mainly adult cases for psychological intervention. A lot of cases like BPAD and yeah, psychosis and other cases were there. So it was
Okay.
regular, not
Okay.
much because I can appoint. I need not be bothered about whether many patients are there. If patients are there, I will give next day appointment. That's all. It was not that hectic in the private hospital. But the
Okay. Okay.
salary and things like that, that will be an
Yeah.
issue because yeah, they were yes. But job satisfaction is good.
Okay. So now, having seen all these three things, now you're working at a vocational center mainly with autism related cases. So this is something I think that you really like to do, and this is something you want to really work on. Is that it? How is it working there right now?
Yeah, yeah. Here my what we call dual roles are they. One is principal of this institution where I have to do a lot of management. And here there are 52 staff members are there, 52. So including all physiotherapy, speech therapy, all the departments are there. So administration is one part. Along with that, my own department, clinical psychology department is there. I am head of that. So I have to manage the therapy session also. So administration and clinical work we have.
So I think one of the things that I need to talk about also is MPhil and registration with the RCI, because that is something that a lot of students are concerned about. And if I'm not
Okay.
mistaken, it's very important to have that registration, no, after your MPhil. So tell us more about that registration and what happens there.
Yeah. So when you enroll for MPhil, actually the institution has to be registered under RCI. So the institution has to be registered RCI. Then only MPhil will be declared valid. If institutions where MPhil, 1 year MPhil, they don't have RCA registration. So RCA recognized institution definitely after completing the course will issue a certificate. Authentication certificate will be issued to us, and soon after completing MPhil course, we can know in the website, RCI website is there. In the website, we can register for it. I think some 1,000 rupee or something is for a registration. So for that, we have to upload all the documents related to the what called passing of the course. So including the marks card, including authentication certificate, including the details of all the certificate has to be uploaded. And within 1 month, you will get certificate that will be sent to your home. So RCA recognition is very important as far as nowadays, the mental health bill also is passed, and where clinical psychologist is what we call defined. So RCI recognized clinical. So that term is there. So we need for a valid psychotherapy and assessment, clinical RCI recognition is mandatory. And every 5 years, we will have to register it. Register in this, renew the registration, because once it is given, it's for valid for 5 years, and for the next 5 years, you will have to again re-register for it. Not registration, renewal of registration. And for in between, you will have to get 100 CRE points also. You will have to attend all the CRE program, and you will get 100 points. Then you are eligible for renewal of registration.
Okay, what is this CRE points?
CRE, in the sense, it's a continued educational program that the RCI has made it mandatory that you have to undergo training, further training. So you will have to attend a training conducted or organized by the Rehabilitation Council of India. So that training you will have to, your score will be made in the RCI website also that you have attended this program. So every 5 years, you will have to accumulate 100 CRE program. Maybe if you attend a 1 day program, you may get 6 points. There are, conferences are there, workshops are there, national seminars are there, and other ones are there. So depending on the type of conferences or seminars you are attending, score also will vary. Suppose you are publishing a paper. Suppose you are, what we call, you are publishing a paper or you get points. So including all those points, you will be getting the registration. That is the problem.
Okay. And do you have to attend these in person, or can you attend them online?
No. We have to attend
In person.
in person. We will have to attend it. I don't know any now new form of interaction or seminars and conferences will be coming. No corona issues. Maybe they may be
Correct.
thinking about. Yeah. But
Correct.
so far, it's no model.
Okay. All right. What are some of the things that a student has to keep in mind if they want to go for an MPhil? What would you suggest?
Usually, in many of the NIMHANS, for example, NIMHANS they have a entrance test is there. You will have to clear that. Then they will call for an interview. And that is the procedure there. It's a national level entrance test they will be conducting. In Manipal, it's a private university. So there, what they are doing is that they will conduct a test. They will conduct a test on the spot. You will have to appear for that, and during that time, there will be both. Objective test will be there and Viva will be there. So after objective test, they will be they will have a cutoff score, and for example, 50 students will be selected for the Viva. So based on the objective test, who are getting that cutoff score will be selected for Viva. Viva, during which the expert will be asking many questions related to that. So you will have to clear that. There will be usually 10 to 12 seats will be there in the for the MPhil. So you will have to perform well. But the questions and the subjects generally, if you are preparing for UGC, if you're preparing for, further career. So you will need to know the basic psychological principles, basic theory, basic all the, lessons, portions related to the PG level psychology. That is expected from you. So they can also ask, especially when you go for, clinical psychology, you will
Yeah.
have to show your communication skills. You will have to show your, areas of interest, and those also will be, clear, your language, all that,
Okay.
consideration. I hope.
Okay.
It's a level.
Okay. So different levels of preparation are needed. But okay, to ask you something related, when would you advise a student not to go for an MPhil?
Yeah, that is a relevant question, because suppose you are not interested in the clinical field, you don't
Hmm.
want to work with, clinical population, especially, people with the depression, or, psychosis or other cases. So if you are not interested in dealing with the clinical population, I think you need not go for it. And much more than that, clinical service require a lot of, counseling skills. For example, we also need to develop our own skills, like listening capacity, patience, right, and also the ability to empathize with people, or, to understand to more about people. So those, counseling skills also you need to develop, isn't it? So
Hmm.
those kind of skills, if you are not possessing, then it may not be. Suppose you are fully research oriented, you want to study, contribute much on, research topic, you want to teach people, that is your areas of interest. But I find that, clinical population, clinical, if you take, you will, you may get a good salary or something, if you think, then that is not a good, indication for, choosing the topic. Rather than, if you are really interested to work with the clinical population, definitely, otherwise don't go for it.
Mhm. Yeah, okay. Very good advice there, because sometimes students get so caught up into continuing to study and gain more qualifications that they lose vision of what really needs to happen. Okay. Um, what next for you? Where are you going from here on?
Yeah, I actually, started, my PhD, not started, but, I am in the process now. I have selected the topic, but that is also not yet finalized. I want to work on parenting skills, especially mindful parenting, mindfulness training, mindful parenting. That is also related to the CBT related. It's so I want to focus much on that. How can I help the general parents, not with the special population, but generally parents are always confronted with a lot of problems, right? So
Mm.
how I can help the parents through this mindful way of, parenting. So that is what my focus is on. I'm reading on it, so I hope I can do something on that. Along with
Wow.
that, I, yeah, read a lot about, behavior therapy, behavior modification, new way of dealing with attending conferences.
Mm.
Recently, there was a uh, topic like teach, means a special way of, teaching autism children. So that
Yeah.
was also my focus. So yeah, I hope whatever program is there for improving my skills, I may be attending that. Yes.
Okay. And the most important question I've kept for last. When are you coming back to Goa?
Yeah. That is to be in Goa, because the it was very easy for me to conduct sessions over there. I can frankly tell you. One thing is
Yeah.
that they are very receptive. The people of Goa are very receptive. And suppose if we systematically give a session, you have to do this homework, and they will definitely do. Not all that, but people of Goa are much more educated, so
Mm.
they know the need of it. Therefore, yesterday there was one case who my regular case only. She was calling me after, I think, 3 4 years. She was telling that
Okay.
I was was doing, I asked her to, diary writing, CBT,
Yeah,
we tend to give home exercise,
correct,
right? Homework. So she was
correct.
doing that homework. Last 4 years, she was
Wow,
continually doing that much of dedication.
wow,
She was showing it. And there was
yeah,
some problem in between. So she had some other issues. So for that only she discussed with me. So in that way, therapeutic intervention on compared to the people here, I find, because here, once they show improvement, what they do is
yeah,
that they leave, they won't come again. When they have a problem, again they will come. They do regular follow up. They were coming regularly, and they were very receptive and following all the homework exercise that were given to them.
yeah. Okay. And I think that
So
must
once
be
he's there, definitely
frustrating,
come
no?
back.
Yeah,
Yes.
good. But that must have been very frustrating for you when you begin to work on a case and then the person drops out and then comes again and again you have to do everything again all over again. It must be really frustrating as a therapist to be in the situation.
Yes, that's surely happening now, because now I'm not able to see my clients. So almost now 3 months are over now. So when
Mm.
I start the sessions again, I'll have to restart again, because it's of no use. We will have to restart again. I have to start from the beginning itself. Of course, that is frustrating.
Yeah, yeah. Well, Jim, I wish you all the best in this new role you have found yourself. It was fantastic to catch up with you. It was a good conversation that we have. Thank you for taking the time out and talking to us today. I'm sure a lot of students are going to benefit. They were asking me to find someone who has an MPhil because they want to know about MPhil. So I remembered you and I said, okay, I need to get in touch with Jim regarding this. So thank you for today's talk,
Yeah.
Jim.
Thank you for the opportunity that I get on a platform. And Harish, you were always with. No, we were going for many conferences also in Goa, and
Yeah,
along with the Dr. Akbar. No, it was a very enjoyable time that
yeah. Well,
uh,
hopefully we'll
I
meet
have
up
learned a
again.
very.
Yeah,
Yeah,
hopefully
thank
we'll meet
you.
up again pretty soon, and I hope we get to see each other in person. Once all this mess is over, we hope to see each other in
Yeah,
person soon.
yeah. So
Right?
convey my regards to the students, and I wish them all the best. Let them become clinical psychologists, because that is the need of the time. So because many cases are there. Recently during the lockdown period, we were getting what we call lot many calls from in Kerala itself and outside Kerala also, those who are working abroad. So many needed our help. So we were associating with the government agencies to give a free online counseling sessions and psychotherapy sessions for the needy. So it is very much needed. Counseling, psychology, psychotherapy is very much need of the time. So I
Uh,
wish that the students, many of them, should pursue MPhil course and let them become clinical psychologists for better tomorrow.
wow. Thank you for the encouraging words, Jim. We'll talk soon then.
Thank you so much. Bye.
Bye, bye.